Hello everyone, it gives me great pleasure to tell you about a project called Filling the Gap between Evidence, Policy and Practice, our 45 and up study researchers planning for impact, a collaboration between researchers from the University of Wollongong and the Sachs Institute. Researchers have long been producers and disseminators of research, with the overall aim of achieving benefits for societies that lie beyond academia. Hundreds of billions are spent annually on research and development, with an estimated 23.1 billion spent in 2018 in Australia alone. However, a consistent finding from clinical and health services research is that research is not being translated into policy and practice in a timely manner. This resulting evidence to practice gap exposes patients to inappropriate care and unnecessary treatments, resulting in significant costs and resource wastage. More broadly, policymakers and program managers report that research is often not timely, relevant, or actionable, and opportunities to integrate research into decision-making are missed. Gaps between evidence and practice have been attributed to multiple factors. Policymakers cite a lack of timely, relevant research, its limited applicability to policy contexts, and insufficient organisational access to academic journals as barriers to the use of evidence in their policies. The discordance between evidence and practice may lead to research wastage. For example, research questions that are irrelevant to decision makers, clinicians, and patients, poorly designed studies, biased or unusable reports of research, and failing to describe interventions adequately. Large longitudinal cohort studies, such as the 45 and up study, can play a significant role in providing high quality evidence for decision making relating to policy and practice. Cohort studies and linked data are one way of generating research that is relevant to policymakers and practitioners. They provide a powerful tool to understanding the changes in health behaviours, and the living circumstances of the population over time. The interactions and cumulative effects of factors that affect their health and the real-world impact of population-level programs and policies. Identifying researchers' practice will assist developing the development of strategies to promote policy and practice impact. The aims of this study were to 1. Identify the proportion of researchers who intended to have an impact and achieved impact, 2. The types of impact they intended and achieved, and 3. The pathways to which they achieved it. A detailed understanding of researchers' practice will assist in the development of strategies to promote policy and practice impacts and the ways they can be measured in research projects such as the 45 and up study. In terms of the methods, this study is a document review of research project applications, progress reports, and final reports submitted by project investigators as part of the 45 and up study mandatory reporting requirements. It compared application forms where the researchers specified their intended impact with progress and final reports where the researchers specified the impact of their work. Research projects were included in the study if they were commenced and completed between the 1st of January 2011 and the 31st of December 2017, where forms were uniform, used a standard format, and included sufficient documentation for analysis. A coding schedule was developed based on recent work in understanding research use and impact from the perspectives of researchers and research funding organisations. Data on the 9 national health priority areas addressed by the research projects were also extracted. The coding schedule defined and categorised the data by type of policy or practice impact, method of achieving research impact, that is the pathway, and target audience. Under pathways to impact, that is how policy and practice impact would be achieved, we included through meetings and interaction with policymakers, co-designing research, lobbying and advocacy, journal article publications and conference presentations, teaching and training, plain English resources, discussion papers and reports, media and social media. In terms of data analysis, intended impact data were collected and analysed from application forms and were treated as baseline data, as they were submitted at the beginning of the research project. Impact data were identified from progress and final reports and considered together as impact achieved. 25 research projects met the inclusion criteria. Project applications addressed 11 research areas with multiple responses possible, resulting in 36 total responses for the research areas. Of the 53% of total responses, which included a national health priority area, 22% were for cancer, 8% for mental health, 8% for obesity and physical activity, 8% for cardiovascular health, 3% for asthma and respiratory conditions, and 3% for arthritis and musculoskeletal health. 88% of project applications mentioned an intention to achieve one or more policy or practice impacts. That is, multiple responses were possible. Of all responses, 52% planned to change a policy or program, followed by health service delivery in 21%. 17% included a clinical practice or process change, and 7% a change in clinical guideline or manual, and 3% an organizational system or process change. Of the 22 research projects which intended to have an impact, 45% did not identify a pathway for achieving impact. Of those who did report a pathway, 25% intended to use academic means only. That is, publishing in academic journals and teaching via seminars and webinars. A further 25% intended to use policy-oriented activities only, that is, discussion papers and plain English summaries, co-designing research and interaction with policymakers, or advocating for change. And the remaining 50% intended to use a combination of academic and policy-oriented methods. Of the 22 research projects that intended to have a policy or practice impact, 18% reported achieving an impact. 3 reported changes to policy, while 1 reported change to legislation. 2 of the 4 research projects described how they achieved these impacts, that is, through interaction with a policymaker in one case, dissemination of findings in a research journal article or a conference in another, or a report or a discussion paper in another. There were 3 for target audiences for the reported results, which included journalists, and 1 for ministers, 1 for policymakers, 1 for hospital or health service administrators, and 1 for clinicians. So to our knowledge, this is the first study in Australia that explores the type of impact planning achieved in research projects from a large-scale prospective cohort study, a 45 and up study. The largest cohort study in the Southern Hemisphere, this 45 and up study is assessed by over 660 researchers. Given the increasing interest in Australia and internationally, to identify, define, and measure research impact, it is timely to describe the type of impact intended and achieved by researchers using the 45 and up study data. Results indicate that researchers are interested in using the 45 and up study data to achieve impact. And indeed, our study indicates the majority of research projects in our sample intended to achieve a policy or practice impact. By the end of the reporting period, some projects have reported a policy or practice impact, 16%. However, this analysis has shown that their capabilities to deliver impact could be improved. There are several reasons for this difference between intention and achievement of impact. Firstly, the reporting period used in the study to assess impact ends at the completion of the respective projects, whilst achieving impact is much more likely to occur well after the completion of a study. Secondly, without validation of the study impacts on policy and practice, it is unclear whether the coding schedule captured all impact achieved within the reporting period. Reliance on self-reporting here is not ideal. Despite these limitations, the results of this study seem to indicate that while researchers intended to have an impact through policy-oriented and academic pathways, research practice is still skewed towards traditional academic outputs. Results of this study indicate a disconnect between strategies researchers are employing to inform the targeted end users about the knowledge produced to assist with their decision-making process. It also demonstrates the need for further investigation into researchers' processes on planning for impact and the facilitators and barriers they encounter.